Hello, students. This is Instructor Cersei. And in this episode, we're going to look at Module 8, Patient Care Skills. The purpose of this unit is to teach the students skills needed to support and or assist the patient or resident in the areas of personal hygiene, an area of activities of daily living and elimination. Personal hygiene or personal care is generally performed independently. The nurse assistant should assist with or perform personal care only when patients, residents, are unable to perform a skill for themselves. Other activities included in this module are use of prosthetic devices, bowel and bladder retraining, and weighing and measuring height of the patient resident. And now, let us pronounce together the key terminology for this module. Repeat after me, please. Abrasion, aspiration, axilla, catheter, colostomy, constipation, cyanosis, decubitus ulcer, defecation, dermis, diarrhea, elimination, epidermis, erythema, eschar, excoriation, fecal, feces, flatulence, hour of sleep, age S, ileostomy, impaction, incontinence, jejunostomy, neuropathy, nits, oral hygiene, osteomyelitis or osteomyelitis, ostomy, perineum perineal, pressure sore, prosthesis, stoma, stool, urinal, urinary incontinence, urination, and urine. So now, let us look at some vocabulary sentences to help you understand these terms even better. Number 1. The nurse assistant cleaned the abrasion on the resident's knee after she scraped it during a fall. Number 2. The resident was at risk for aspiration because she had difficulty swallowing liquids safely. Number 3. When taking a temperature, the nurse assistant placed the thermometer in the resident's axilla under his arm. Number 4. The nurse assistant emptied the urine from the resident's catheter bag every shift. Number 5. The resident with a colostomy needed help changing the collection bag on his abdomen. Number 6. The resident had constipation and had not had a bowel movement for 3 days. Number 7. The nurse assistant noticed cyanosis around the resident's lips, which appeared blue from lack of oxygen. Number 8. The nurse assistant turned the bedridden resident every 2 hours to prevent a decubitus ulcer from forming. Number 9. The nurse assistant helped the resident to the bathroom for defecation when she felt the urge for a bowel movement. Number 10. The dermis is the layer of skin under the epidermis that contains blood vessels and nerves. Number 11. The resident with diarrhea needed frequent assistance to the bathroom for loose, watery stools. Number 12. Elimination includes all the ways the body gets rid of waste through urine, stool, and sweating. Number 13. The epidermis is the top layer of skin that protects the body from germs and injury. Number 14. The nurse assistant reported the erythema or redness around the resident's surgical wound to the nurse. Number 15. The burn victim had eschar, which was dead tissue that needed to be removed by the doctor. Number 16. The resident had excoriation on her arms from scratching the itchy rash too much. Number 17. The nurse assistant tested the resident's stool for fecal blood using a special test kit. Number 18. The nurse assistant observed the color and consistency of the resident's feces before disposing of it. Number 19. The resident complained of flatulence and abdominal discomfort from too much gas in his intestines. Number 20. The medication was given age S, hour of sleep, which means it should be taken at bedtime. 21. The resident with an ileostomy had liquid stool that drained into a bag attached to her abdomen. Number 22. The resident had a fecal impaction with hard, dry stool stuck in its rectum that needed medical attention. Number 23. The resident with incontinence could not control when she urinated or had bowel movements. Number 24. The resident with a jejunostomy received liquid nutrition through a tube in her small intestine. Number 25. The resident had neuropathy in his feet, which caused numbness and tingling from nerve damage. Number 26. The nurse assistant found nits, lice eggs, in the resident's hair during the head examination. Number 27. Oral hygiene includes brushing teeth, flossing, and cleaning the mouth to prevent dental problems. Number 28. The resident developed osteomyelitis, a serious bone infection that required antibiotic treatment. 29. The resident had an ostomy, which was a surgical opening in her abdomen for waste elimination. Number 30. The nurse assistant cleaned the perineum area between the genitals and anus during personal care. Number 31. The nurse assistant used special cushions to prevent pressure sores on the wheelchair-bound resident. Number 32. The resident used a prosthesis, artificial leg, to help her walk after her amputation. 33. The nurse assistant changed the collection bag around the resident's stoma, artificial opening, on his abdomen. Number 34. The nurse assistant measured and recorded the amount of stool the resident produced each day. Number 35. The male resident used a urinal to collect his urine when he could not get to the bathroom. Number 36. The resident had urinary incontinence and wore protective undergarments because she could not control her bladder. Number 37. The nurse assistant assisted the resident with urination by helping her to the bathroom every 2 hours. Number 38. The nurse assistant measured the resident's urine output and noted that it was dark yellow in color.